If you want birth control without hormones, this is the video for you. I am covering them all, so let's get going. Hey everyone, welcome back. I'm Dr. Jen, a board-certified OBGYN, and this is the health class you didn't get in high school. Before I jump into all the kinds of hormone-free birth control that you can try, go ahead and like, subscribe, and turn on that bell so you never miss an upload. I have a lot of birth control content on this playlist here that you can scroll through and get tons of good information on, but I realized one that I don't have is covering all the kinds of hormone-free birth control that you might want to use. So that's what today is for. I'm going to cover all the different methods, and as always, references and resources are in my show notes for more. The first method of hormone-free birth control is abstinence. I don't think I need to say a whole lot about that. It is 100% effective if you are purely abstinent and you don't have a penis going into a vagina. There are obviously some pros and some cons with that one. I will let you work those out on your own. The second one that is a hormone-free kind of birth control that I get asked about all the time is natural family planning, or what some other people call fertility awareness method or the rhythm method. There's lots of names, and it is really important to know the different options there, how to use it properly, what works, what doesn't, who can use it, who can't. And I made a whole video about that. So if that's what you're looking into, that is the video you need to go watch. Okay, the third type of hormonal-free birth control is the copper IUD, also known as the Paragard. It is FDA approved for 10 years, but it likely works up to 12. But I just have to say that. And this is one of the most effective forms of birth control altogether, but especially non-hormonal birth control. It is over 99% effective, which means that if 100 people use this birth control method for 1 year, less than one of them would get pregnant. And I'm saying it in two different ways because I think it's really helpful to know how good a method is or how bad it is. So I'll give you both of those information points on all of these methods. What are the pros of it? Well, it's really long lasting, right? It's a set it and forget it. You don't have to do anything, and it's private. Nobody will know that you have it. Another really awesome thing about it is that it can also be used for emergency contraception or as a morning after pill. And you can have it inserted up to 5 days or 120 hours after unprotected sex, and it is remarkably effective at preventing pregnancy. And then you've got a plan A moving forward because it's there. Yeah, there are some downsides or some cons to the copper IUD. The main one being that you have to have it placed, right? You have to go in and see a healthcare provider and have a procedure. There's lots of information and talk about what IUD insertions are like, and I want you to watch this video if you have questions about it, including options for pain control, which absolutely there are options out there that you have a right to ask about and a right to access. Some other downsides of the copper IUD is that it can be expensive. It is covered 100% under a lot of insurance plans, and a lot of places like Planned Parenthoods or county or community clinics will give it to you for free if you can't afford it. So I do want you to know that. It does not offer any protection against sexually transmitted infections. And the biggest one that I hear about a lot is the bleeding profile. So with using a copper IUD, some people who use it may have heavier periods or crampier periods. So if you already tend towards that, this might not be the best thing for you, but you also don't know till you try it. Another type of hormone-free birth control is sterilization. So I'm talking about having your tubes tied or having a vasectomy. Also remarkably effective, over 99% effective, meaning over a year, less than 1 in 100 people using this method will get pregnant. So you heard me, it's not 100% effective, but it's really good. The benefits of this is that it's done. There's nothing to do. It can be done at the time of other surgeries like having a C-section. But the downsides are that these are irreversible. Now, yes, you will hear some people who have talked about having their tubal ligations reversed. More and more commonly, though, the way that we're doing it is we're removing the tubes entirely. That cannot be undone. And for even people who try to have reversals, a lot of times insurance doesn't cover it. And since it is a surgery, it can be costly. And so access can be an issue too. There are some people who've tried to get their tubes tied and they're younger or they don't have kids before and their doctors refuse to do it. And that's because there's a theoretical risk of regret. I believe in bodily autonomy, and if you're counseled, you should be able to access the healthcare you want. Here's a link to a list on Reddit. Yes, it's a legit list of healthcare providers who will provide these services without you having to haggle and harass and prove that you don't want to have kids. Another downside is it doesn't offer obviously any STI protection. Okay, let's talk about the category of barrier methods of non-hormonal contraception. The one I think we've all heard about the most are condoms. So there are both external condoms, which are probably the regular condoms you're thinking of as I'm saying that, but then also internal condoms that get placed in the vagina. Stupidly, these require a prescription. I will include a link in the show notes of where you can go to get that. So stupid. External condoms are about 87% effective, which means that over a year, if people are just using condoms, 13 out of 100 of them will get pregnant. And internal condoms are about 80% effective. So the positives of condom use is that you not only get birth control, but you also get protection against sexually transmitted infections. The downsides is that you have to use them. You have to use them reliably for them to work. And they're not as good as some other methods, but they're definitely better than nothing. These things can also break, and so if that's the case, or if you're relying on these, you may want to have some morning after pills or emergency contraception on hand. You can go to a website where I created a hub where you can see how to get these sent to you. It's called freeforfreedom.com, how you can get these in all 50 states. These are legal. Morning after pills are legal in all 50 states, but that's a topic for another day. So yeah, condoms, you just have to make sure that you use them and you use them correctly. Okay, moving on to another form of barrier contraception are diaphragms. Yes, diaphragms are still around. There are two different kinds. There's one that has multiple sizes that you have to go to a doctor's office to get fitted for, and there's another one called the Kaya diaphragm, which is a one size fits all or fits most. You must use diaphragms with spermicide in order for them to work. And the way diaphragms work is that you can place them up to an hour before sex, and you have to leave them in for 6 hours after sex to kill any of the spermies hanging around. But you can't leave it longer than 24 hours, and I'll include a link down below to show how insertion of the diaphragm is done. It's about 83% effective, meaning over a year, 17 out of 100% of people using this will get pregnant. The positives is that you can use the same one for 2 years. So once you get a Kaya diaphragm, which by the way is prescription only, and I will include a link how to get that. But once you have it, you can use the same one for 2 years, which is great. The negatives, I mentioned the fact that it has to be a prescription only, the fact that it doesn't protect against STIs, and you have to be comfortable inserting and removing and doing all of those things. The next type of barrier birth control without hormones are cervical caps. And I'm gonna be honest, I've never known a patient who's used this, but they're definitely out there. It's a one size fits all, and you have to use it with spermicide. And as you can see in this picture here, it's like a little cap that fits on the cervix. These are about 71 to 86% effective, meaning 14 to 29 out of 100 people using this will get pregnant. And it's less effective if you've had a full-term vaginal birth before, because the cervix shape and size can change, and so this cap may not work as well. The positives, I don't have a whole lot, other than it's another option. We love options. But the negatives is that it's got a pretty high failure rate. You need to be fitted for it, and it may not work as well if you've had a vaginal birth like I described before, and doesn't offer any STI protection. Okay, moving on to spermicides. These can be things that you use with other methods like a diaphragm or condoms, like I mentioned, but they can also be used alone, like a gel or a suppository or a film. Many of these are over the counter, although there is one brand that is prescription only called Phexxi, which it drives me nuts that it's prescription only. I just think there's not a huge difference between over the counter and prescription spermicide, so use what's accessible to you. So spermicide is really best if it's paired with something, and they work for an hour, meaning if you're still having sex after an hour or you haven't started yet, you do need to use more spermicide. These are about 80 to 85% effective, meaning a 15 to 20% failure rate out of 100. And the pros is that for most of these are over the counter, so easily accessible, and a lot of these are pretty darn affordable. Now on the negative side, they don't offer protection from STIs. They can cause some real skin or vulvar or vaginal skin irritation. It may feel messy, it has to be reapplied, but it's another option. It's another tool in the toolbox. And just as a heads up, Phexxi, the pricing, I think it drives me nuts. It can be $389 for 12 tubes with no insurance. That's ridiculous. I'm sure there's assistance available, and some insurances probably do cover it, but that price point is just ridiculous. Okay, the last big one that I haven't covered yet is withdrawal or pulling out. This is about 80% effective, which means 20 people out of 100 every year will get pregnant if this is the only method that they're using. The benefit is that there's no side effects other than pregnancy. So just keep in mind that this is a good method to use if you wouldn't be that upset if you got pregnant. The downsides is that you have to be perfect at this, and you have to trust a partner that they will pull out. And if somebody is drunk or high, they might not be able to do that. So again, if you're using this method, you may want to have some emergency contraception on hand. And yes, withdrawal is better than nothing. I am not here to shame you if that's the method you choose. Okay, what about some things that may be coming soon? First of all, what about male birth control? I made a whole video about this here. Yes, I will be super excited too when something is available and hits the market. I think we can all agree on that. But what about something else called Ovaprene? You can see I made this TikTok here to show Ovaprene is this vaginal ring that secretes iron. So it's not a hormone, hormone, but it secretes iron, which damages sperm, and it also has a little mesh. This is currently in the study phase, and it's very early in that phase, but I do want to make you aware they are enrolling people to participate nationwide, and I will include that link in the show notes below. I am not sponsored or affiliated with that at all, but I did want you to know there's another thing in the pipeline. Okay, references and resources in my show notes. What questions, comments, thoughts, feedback do you have about hormone-free birth control? We love lots of choices. Just know that some may be more effective than others, but at the end of the day, it's what feels right for you. If you're not already following me on my other socials, go ahead and do that. And until next week, stay safe, stay empowered, and stay protected. Bye-bye.